Today, we have Obesity and Food Insecurity by Kyskie Bolton, Program Director from GA Carmichael Family Health Center.
In this series, and I do encourage everyone to go ahead and watch the entire series that the Community Health Center Association has presented. This is what we went over: obesity, nutrition, exercise, and physical activity, and how they interact with our comorbidities, hypertension, diabetes, stress, and now here we are with food insecurity. So the first thing that we have to establish is what is good nutrition, because food insecurity is the hallmark of poor nutrition. So a generally healthy diet for the average person is going to be drinking about 6 to 8 cups of water each day, more or less depending on age, eating foods from each food group daily, knowing and eating proper serving sizes, avoiding low nutrient foods, which we usually call snacks, getting 25 to 35 grams of fiber a day, and that's for women and then men, eating 5 to 7 servings of fruits and vegetables daily, having routine meals, which means not skipping meals, and avoiding too much alcohol, which is drinking more than 1 to 2 drinks every day. So the first thing that we really want to get out of the way is, what is food insecurity? Using my kids as an example, which I always use, they sometimes probably think they're food insecure, and that's because they're not eating what they want. They're not getting what they want. The refrigerator can be filled with food. We can be throwing away leftovers. I cannot have enough space to put frozen food in the freezer portion of the refrigerator. And if you ask them, do y'all have anything to eat? They will say, no, we don't have anything to eat. I've even told them, don't tell people you don't have food to eat just because they say that. So food insecurity does not mean you don't have food to eat. It means that you are in the condition where you are unable to provide yourself with what you see here on the screen. You're unable to have access to what constitutes good nutrition. And that inability can be multifaceted. It can be budget. So you may have the knowledge, you may have the ability to cook, and you may have great transportation. Speaking of like people who live in the inner city. So if you live in the inner city, of course, our largest cities are going to be Jackson and the coast and South Haven area. But for people who live in inner cities, they can ride a bus, they can ride transportation and get to places, but there may not be anything in their community that has what they need, or they have stores, but those stores don't provide a wide variety of fresh items to them. And it could also be that using my dad as an example, he was not in a budget issue. He didn't have budget issues. He had a vehicle, but his health kept him from being mobile enough to be the primary person to shop and cook and prepare foods for himself. So food insecurity is a wide range. It could be that you just do not have the money or knowledge. You may not have be in a location. If you live in rural Mississippi, I just left a place called Leaksville. Did not know that existed. It's very rural. You have to drive to get what you need. So once we establish that you are food insecure, do know that food insecurity contributes highly to obesity, almost sometimes more than anything else other than genetics. Food insecurity is the hallmark of obesity because you are so limited in your choices that you almost have to choose poor things. And about 32% of us are going to be more obese if we also are food insecure. So if you are food insecure, what we're going to do is we're going to talk about what can you do. There's no perfect solution for everyone. The Community Health Center Associations serve people of all ages, races, and income levels. We serve people who are very, very poor, impoverished, with no income, all the way up to what we call the poverty level, all the way up to professionals who just continue services in their community with our providers. So each one of those people can be food insecure. You can be food insecure with a lot of money, because you just may not be able to on a daily basis get to what you need to get if you're living in a rural area, or you may not have the knowledge to prepare foods. Money does not equate to knowledge. So we're going to talk about budgeting, how you can sign up or identify things that you can use. We're going to talk about planning, cooking, partnering with people, getting things growing, and getting involved. And this slide we just left, this is a picture of the percentage of children who are food insecure in the nation, and that is as of this year. So as us being Mississippi, we are the #1 state in the nation for children who are food insecure. So the first thing that we have to do is to determine whether or not our budget is actually causing us to be food insecure. Are we food insecure because we really do not have the income to purchase the foods that are going to give us that good nutrition? Or are we just don't know what we're spending? And I know for myself, even though I'm not food insecure, I definitely do not know how much money I spend on food. Because in order to know what your food budget is and what you're spending, you have to account for every actual food, beverages, any coffees you're buying, snacking, vending machine, convenience stores, if you're going through the drive-through or takeout, if you're going to sit down at restaurants, if you're having parties at your home or taking food to parties, if you are attending celebrations and contributing to that, and a big chunk of that can also go to alcohol if you're drinking that. So sometimes we assume we are food insecure, but really what we are is not keeping up with the budget, not setting a budget, and not thinking about how much of our disposable income that we're using for food and for beverages. So if you feel like you're struggling with your budget, and there are people who don't have to, do this. They know for a fact that they just do not have the money. They're searching for ways to get more. But if you feel like you can wiggle around, take some time for a week or two and really, really look at every dime you're spending on food. And you may be surprised that you really are spending a lot more than you think. So what we want to make sure that we're doing is be honest with ourselves. Do you really spend all your money at Chick-fil-A, and then when you get home, you're hungry and you say you don't have anything to eat, Are you spending your money at Starbucks or at the local convenience store buying $10 and $15 worth of snacks, and then in the evenings, you feel like you don't have a good supper? So just take a good inventory of yourself. So once you have determined that you either do or do not have the money, and you know exactly what your food budget's going to be, you've looked at your other costs, your housing, utilities, and what you have left, make a plan for how much money you want to spend on a weekly, bi-weekly, monthly basis, however your money flows. If you are not good with sticking to a budget, and I'm pointing to myself, pay in cash. I did that this week with school shopping. I took cash money in with myself and with my kids, and each one of us was disappointed, but we stuck to the cash that I had. I refused to pull my debit card out because it's so easy to spend too much money when you're using debit. So you don't have to pay in cash, obviously, but if you have trouble with that, pay in cash. One thing that used to be a common thing for most, especially women, is planning out a weekly menu. But if you're not doing that, I highly encourage you to plan out a weekly menu of what you're going to have for breakfast, lunch, and dinner. That may be something that you're going to have something outside, but have a plan for that. Because when you do not plan on what you're eating, you're going to be subject to buying snacks here and there. You're going to be subject to going in and out of restaurants, and you're going to be subject to ordering or just making really quick, fast meals that sometimes are not economical. So when you plan out a menu, you're able to shop by your menu. When you plan out a menu, you know what you're going to get in the store, and you know what days you're going to cook those foods. Shop according to the menu. And of course, a lot of times it takes a little work. I know some couponers out there. I know some extreme couponers. They take full advantage of coupons and sales, and they save a lot of money. You don't have to be on the show extreme couponing to really, really save money. So take advantage of coupons and sales that are in your local stores. If you can, buy in bulk. Make sure you have a good amount of staples, and staples are going to be your rice, flour, pasta, your canned goods. If you use canned goods, your frozen fruits and vegetables, those things keep a long time, and you can always make meals out of them. That way, if you have a protein source, whether that be beans or something like that, or meat, you can make a full meal around those if you have staples at home all of the time. If you do not want to pay the cost for a membership to a place like Costco or Sam's, go in with your family members. Make sure that you know who's got a card or something like that, and you can make a day out of shopping in those stores and saving money like that. Another thing that's most important is if you are not single or if you're not living alone, make sure that the family is doing this together, because you can be on board with a budget and you can be on board with a weekly menu, but everyone in the house needs to know what's going on, because it's going to be a little bit more difficult if everyone's trying to do something different. So once you know what you're going to buy, you have the money, you're going to buy it, you stick to it, you got to use it. Once you get that food into the house, that really is just the very first step. I can't tell y'all how many times I have gone grocery shopping, and I do have a large family, bought tons of stuff, had tons of plans. And I was so tired from doing all that I stopped by and got some food from somewhere else because I didn't feel like cooking, because I was tired from doing that. You have to make a full plan. So a lot of times on the day that I do a lot of grocery shopping, I don't cook that day, but I go home and prep. So what food prep really means is you are breaking down what you're bringing into your home. I'm asking you to eat 5 to 7 servings of fruits and vegetables a day. It's really not as much as you think. It sounds like a lot, but that's usually about a half a cup. But how are you going to get those fruits and vegetables? Who's gonna keep those fruits and vegetables in the refrigerator or the freezer like that? So you have to know how to preserve your foods and how to keep it so that it doesn't go to waste. There's nothing like throwing away food that you bought and it's spoiled and you have to throw it away and nobody ever ate it. So one of the things that I do with my family is I buy meat and I buy frozen vegetables and things like that. And as soon as I get home, I separate it out into bags. I separate it out into sections in my freezer so that when it's time to cook, those bags are ready to be defrosted or ready to go in a crock pot or something like that. And it takes a lot less time. There's this new movement that I've seen on TikTok and on YouTube and things like that, on people using lots of techniques to store fresh fruits and vegetables. And that's usually vacuum sealed, actually in just like jars, in mason jars and things like that. So definitely get out there with social media and other places, and you can find all sorts of techniques to keep your food fresh longer. Invest in tools. So of course we're talking about food insecurity. We're talking about people who do have low income, but investing in things like a vacuum sealer, basic things like learning how to can, or even just having glass jars or metal or glass containers that you can close all the way up, can really make a difference in keeping your fruits and vegetables longer. So once you have figured out how much money you have to spend, you've gotten your plan together, and you have the food, there may still be some shortcomings. You may have done everything that you could do with the money you have and you still need more. There's tons of options out there. And the first is going to be the SNAP program. You can apply for that online. And also PEBT. So what PEBT is specifically for families of school-age children who are in Mississippi schools. Everyone, regardless of your income, regardless of whatever, if you apply for PEBT, you can get funds that the government have put aside specifically because of coronavirus to help you cover the cost of food during the pandemic because your children were home. I know that there's some PEBT funds that are going to go out this month to cover the summer costs. And here at the conference I was attending, I've heard that there are already schools in Mississippi who started school and then had to end, or who had to go back to virtual because of outbreaks that occurred in the district. So what you want to do is make sure that your children have applied for free school lunch. Once they've applied, if you are living in a district where they have the PEBT program, which is every district in Mississippi right now, if there are more funds added to the PEBT program, it'll automatically come to your card. You don't have to request it or check on it. At some point, those funds will automatically be loaded to cover the cost of feeding kids while they're in virtual school. And that can be partially virtual or fully virtual. The WIC program is a great program for children 0 to 5 and pregnant and breastfeeding moms. It provides a full food package, including fruits and vegetables. And of course, I can tell you tons more about WIC. If anyone wants to know, you can contact me. There are food pantries generally in every town, every community. Sometimes they're run through nonprofits, sometimes through churches. But just Google that or ask around and you can find lots of food pantries. Community gardens are a big thing and are things that are being funded right now where you can just walk up and pick and get food. So check out community gardens. Summer feeding is ending because school is starting, but that's an option to get free breakfast and lunch. And in some communities, supper for your children. Free school lunch is a new thing that is nationwide. And it is something that you can be utilized as long as you let your school know that you want to get free lunch. Transportation assistance is another thing that most communities have. In the Madison County area, it's called the Madison County Citizen Services Corporation or something of that nature, where there are little vans or small buses that transport people from their home to the doctor, to the grocery store. They go into metropolitan areas. From my hometown where I'm from, there's a Copiah County Citizen Services Agency. They take people to Jackson, they take people all sorts of places, to Brookhaven, Macomb, to doctor's offices and other things that they need as a free service. So sometimes there are lots of things out there that we just don't know about and we have to ask. We should definitely make sure that we are visiting our local farmers market and local farmers. So again, I'm from Copiah County. There's a farm out there called Rutledge Farm. They have drive-up services. You can drive to Rutledge Farm, drive under their canopy, and they will of course sell you full size 20, 30, 40 gallon bags of different types of fruits and vegetables that you can take home and preserve and keep up or share with your friends and families. So one thing that Rutledge is known for are peanuts. They sell fresh peanuts, which are the ones that most people use, they boil. You can also buy dry peanuts from them as well. But what my parents used to do and my family used to do, they would buy 6 or 7 huge, I don't know, 20, 30 pound bags of peanuts in the fall, right about now. And then they would take it to church and people would just pay them back. They would pay them $2 and $3 for it. So sometimes we kind of have to go back to old ways of sharing, carpooling, purchasing cooperatives where people get together and buy things in bulk. Purchasing cooperatives are something that the Community Health Center Association is actually looking into now. And as more information comes out, I'm sure Dr. Fuqua or Maria Morris will get that information out. So another thing which I highly recommend, I used to do it and I'm trying to get back to it, is gardening. Gardening is a surefire way to have something to eat. And there's so many things you can have. Some of the easiest things that you can grow that you don't have to watch or weed or tool are potatoes, cucumbers, squash. And then here I put a little picture of people growing lettuce and growing herbs. Now this is real high tech. This is just a photo I found on the internet, but I recommend using what you have. You can save your egg cartons and put little pieces of fruits and vegetables in there. So I use herbs like parsley, I use cilantro and things like that. You can take a piece of the parsley, a piece of the cilantro that you have, that you bought from the store, cut it and put it in a little water. Over a few days, you will see little roots grow. And you can put those, once they sprout, use for grow. Same thing for milk cartons. You can, Dr. Fuqua, can you still hear me? I'm getting a message that my internet is unstable.
We hear you, and
Great.
you just have a couple of minutes left.
Okay. So another thing that I just started doing is saving cuttings of potatoes and lettuce. So when you buy things like romaine lettuce and you see that base, you can actually trim some of the base off and put it in water, and lettuce will grow out of that. Googling this information can definitely help, but you can also go to your local garden center, the extension service in every county, and master gardeners. A lot of places, if you sign up for their email or newsletter, they will have notifications where they'll be doing either a plant swap or a plant sale, and you can buy different plants for very, very low prices. If you live in a more metropolitan area, Lowe's actually has a policy that any plant you purchase from them, if it does not produce or grow, you can take it back to the store dead. It can be dead with no leaves on it, and they will give you your money back. So there's really not a lot of excuses that someone can make if they want to start growing things, because there's tons of ways to do it. Just look it up. So the last thing that I'm going to talk about is getting involved. A lot of the reasons why we have food insecurity outside of budget reasons is because our cities and our state and our chambers of commerce and our different types of businesses are just not set up to accommodate people who have lower incomes or people who are more rural. But if we advocate for ourselves, and that means as a part of our local, state, and national lawmakers, we can advocate for change. One of the things that people do not do anymore is actually write letters. I have written a letter to one of the senators in DC recently, and they called me back personally because they hadn't gotten a letter in a while. You can write a letter. It doesn't have to be paragraphs long. You can email your state and local officials. You can show up to meetings and advocate for those changes, because when people are food insecure, the economy suffers. When you are no longer food insecure, you're able to participate in the economy and you can improve it. So we know that economics is the driving force behind anything, but we're not going to get our voices heard if we don't say anything. So this is a link, and you can look it up if you want to, that there is a organization called Urban Transitions Alliance. They advocate for changes in urban areas, but they can also be equated to agricultural areas because they have the same issues that we do. Unless you live in the suburbs, you really are going to have a hard time finding food and you having transportation. So you can check that out if you would like. Now, Dr. Fuqua said that there wasn't a lot of time, so somehow I made it almost to the end, seemingly on time. So do remember that if you fail to plan, you plan to fail. So make sure you're looking closely at your budget. Sign up for things that are offered and available to you. Plan out your meals and cook them. Partner up with your local neighbors and associations. Grow your food if you can, and definitely get involved in organizations so that we can make changes so that future generations do not have these food insecurity issues. Does anyone have any comments or any questions?
I would just like to thank you so much, Kyskie, for this presentation. It really was timely, a lot of information, even as we started out with a few technological challenges. I want to remind everyone that we have the entire series of 65 by 65 webinars on our YouTube page. This one will be downloaded as well. So if there's anything you want to revisit from this conversation with Kyskie Bolton, please go to our YouTube page and access those webinars, this one in particular. And if you do want to have information on how to get to our YouTube page, just send me an email. I will provide that for you. And we also have contact information for Kyskie and myself. So thank you all so much for joining us. Bye now.